All right, well, good evening, everybody. I'm Karen Christianson. I'm the chair of Mid-Valley Healthcare Advocates, and my co-host for this evening is Dr. Michael Huntington, who is a retired radiation oncologist, and he'll introduce himself to you in just a few minutes. As for myself, I'm a retired lawyer, and in my professional life, I served many roles. I was a city attorney. I did labor negotiations during probably 30 years. For my law firm, I was in charge of purchasing our group health insurance. Then as an attorney, I served as an advisor to people who were doing estate planning and probate, and many of them were experiencing a lot of stress over medical bills and also the fear of losing all of their estate to nursing home expenses. These experiences have caused me to believe that we can and must do better to create a system that provides high quality care to all people for less money. Mike, why don't you take a few minutes to give a little bit of your background?
Okay. I just wanted to reiterate what Karen said and just point out that the central themes, before I talk about myself, central themes in our presentation tonight are freedom and sustainability. We may be the land of the free, but we're not truly free if we can't have healthcare when we need it. Our lives and our economy are not sustainable if we continue to allow healthcare costs to crowd out our ability to pay for other necessities and benefits of life. So how do I get interested in all of this? I spent 35 years as a radiation oncologist. I enjoyed the work. I felt privileged to be an intimate part of people's lives as I helped them through a crisis. For some, the challenge was simply getting through the illness and the treatment successfully. But for others, it was the deep worry about how were they going to pay for this treatment and still have a bank account or a house to live in afterwards. This is not freedom. This is not sustainable.
Well, our current system, as Mike has indicated, provides care for sickness, not truly health care. And the commercial insurance industry is the biggest threat to our healthcare choices and our freedom to get the care we need at a price that we can afford. We can do better, and we can create a system that provides quality care for more people at less cost. Americans spend more for healthcare than the citizens of any other country. Healthcare costs more than food, clothing, or housing. This is absolutely not sustainable. The Oregon Health Authority has recently reported that the cost has gone up 6.5% per year since 2013. During that time, deductibles have gone up by 77%, shifting more of the cost of care to consumers. In 2019, we looked at the cost of care adjusted on a per capita basis, and this has been adjusted for inflation. The Kaiser Family Foundation reports that it now costs us per person $11,000 for healthcare. Now, of course, you might not experience this number. There are some people who pay much more and some people who are fortunate enough to pay much less. But if we divide the total amount that's spent on healthcare by the population of this country, it's $11,000 per person. We have some economic indicators that are very encouraging. The gross domestic product has been going up for 3 years, and unemployment has fallen to 3.6% prior to the coronavirus pandemic. The stock market has consistently been on the rise, and the annual inflation rate has been falling. But some other indicators of how well we're doing have gone in the other direction, and they are the ones that indicate the quality of our life. So for the past 3 years, life expectancy has been falling, and 40% of Americans cannot pay a surprise bill of $400. Deaths of despair, suicide, drug addiction, overdoses, alcoholism are at an all-time high. And at the same time, our trust in institutions and our ability to receive help from any credible source is low.
So how do we currently get our health care? Through an accident of history, that is wage controls during World War II, health insurance became tied to employment. About half of us still get our health care through an employer. And over the past 50 years, commercial health insurance has changed from an equitable and reasonable system to one in which clients are chosen basically on profitability. They call it cherry picking and lemon dropping. As a result, the wealthy and the healthy have affordable health care insurance and access to health care, but the unhealthy and the unwealthy tend not to. 1 in 3 Americans are unable to afford health care. You probably know someone in that category, perhaps within your own family. A very small percentage of us have individual policies through the marketplace under the Affordable Care Act. About 8.5% of us are uninsured, and about 40% receive health care through public funding, such as Medicare, Medicaid, the VA system, and the Indian Health Service. The complex and confusing healthcare insurance system that we have, even with the help of the Affordable Care Act, has not controlled the pricing of healthcare. It's pricing that makes it inaccessible. You might hear defenders of the private insurance system imply that multiple insurers allow freedom of choice. In reality, there is little choice in commercial insurance because the employer may have only 1 or 2 plans to choose from, and often those plans are restrictive in terms of what doctors you can see and what services you can receive. Insurance companies determine what services are available, how much is covered, and which doctors and other providers you can see. This is the opposite of freedom, and this is unsustainable. As you saw, all of these costs are being generated by our complex and overpriced system, costing Americans on the average of $11,000 per year. Now, for a family of 4 receiving health insurance through the employer, about 1/3 of the family's expenses go to healthcare. That's including the insurance premiums paid by the employee, that which is also paid by the employer, and that has to be considered foregone wages, so it's really from the employee. And then other parts are from out-of-pocket expenses. So why does it cost so much? Well, we talked about how complex our system is. There are 900 insurance companies, each with a dozen plans, all requiring some form of negotiation with the healthcare providers. Providers spend hours on the phone getting pre-authorizations and fighting to have claims paid for. On the left, each of the little rectangles represents an agency, office, clerk, a lucrative consult service that has flourished to serve the commercial insurance model. In stark contrast, the system in Canada is very transparent and simple and easy to navigate. The per capita, it costs about half of what our system does, the Canadian system does. And yet Canadians enjoy better health, longer life expectancy, and most of all, they don't have to worry that their family's financial future will be lost because of medical bills. The providers are well paid, they're generally well satisfied, their lives are simplified because they don't have to haggle with insurance companies or worry that their patients cannot afford recommended treatments. For both patients and healthcare providers, this means freedom and sustainability. Waiting times for elective surgeries can be 4 to 6 months, but on average, no longer than waiting times in the United States. Dealing with the complexity of our healthcare system has tremendous costs. In the United States, there are between 1 and 2 billing clerks for every bed. In Canada, there is 1 billing clerk for every 100 beds. So what happens to these jobs when we have universal healthcare system? What happens to those clerks in the insurance offices or the doctor's offices? Well, as is with other industries, workers learn new skills and take on productive jobs. Billing clerks who are now paid to deny claims can be trained to provide health care. They can become nurses, doctors, medical assistants, technologists. Similar job transitions have occurred in many other fields. The CEOs of insurance companies are not evil. They are simply running a business. But I think we can agree that they're in the wrong business if the goal is population health. Health premiums provide $627 million in royalties per year to the AARP for referred business. Other companies spend millions of dollars for logos, for sports arenas, or for TV ads. All good business, but not good for our health.
Abraham Lincoln said that the legitimate object of government is to do for a community of people whatever they need to have done that they cannot do well for themselves as individuals. This is an important concept to apply to how we deal with healthcare. In our country, we provide certain services that we think are important and yet are difficult to do individually. These services are therefore performed by government or regulated closely by government. These are services like fire protection, police protection, construction and maintenance of roads, our electric utilities, gas utilities, water and sewer utilities, and schools. They are all operated for the public benefit. The model that this country has used successfully since 1965 is Medicare. And this model can be used as the basis for the reforms that need to be accomplished.
So Karen and I have some encouraging news for you. There are several bills in Congress now intended to bring universal health care for all Americans. They are generally called Medicare for All. And this does not mean the Medicare that we have today. It has many flaws. For example, Medicare cannot negotiate price with the drug industry. It cannot use standard evaluation techniques like quality adjusted life years to determine whether a service or a drug is even worth paying for. So we invite you to research these bills. Probably the one we feel is most likely to create a universal healthcare system that works well is House Resolution 1384. It's sponsored by Representative Pramila Jayapal of Washington. A similar bill in the Senate is S 1129, sponsored by Senator Bernie Sanders. I encourage you to look those up online and learn what they consist of and what you think they should include or should not include. But this year there is HR 6906, which is an emergency bill to provide health care through Medicare for anyone who has lost their job because of the pandemic or didn't have insurance beforehand. So please research those, see what you think of them. So why do we think that Medicare for all will mean freedom and sustainability? Well, let's see where we are now with our current healthcare system. I think it represents the opposite of freedom. This graph shows a comparison of the United States to 16 other countries in terms of life expectancy, longevity. On the vertical axis, partially hidden on the left there is ranking of our longevity compared to other nations. We would like to be number 1 at the top, but look where we are, number 17, way at the bottom. As you can see here, for every decade of life, and this compares us to other countries like Australia, Austria, Canada, Denmark, Taiwan. For every decade of life, we are at the lowest of life expectancy through age 65. Pretty depressing. But look what happens at age 65. This is a patriotic slide. It shows that we must have some of the best care providers and facilities if we can do this for people once they are qualified for medical care. Look what happens at age 65. You do live longer once you have health care. This means both freedom and sustainability. 1 in 3 Americans now under the age of 65 cannot afford health care, so they get sick and they die early. The ultimate loss of freedom and sustainability.
In Oregon, our legislature has passed a bill in 2019, was known as Senate Bill 770. And through that bill, we are exploring how to establish a single-payer universal healthcare system. It requires that a task force of 13 voting members produce a report to the legislature in June of 2021, which would outline exactly how this is going to be done, including the big question that's always on everybody's mind: how are we going to pay for it? All of the meetings of the Oregon legislators, whether it's task force or committees, are virtual meetings, and information and a link to that meeting can be found on the Oregon Legislative Information Service website, known as OLIS. The task force is required to engage the public in doing their work. These are the task force members in the group photo, and then the first 2 pictures down below. They represent diversity in educational backgrounds, age, race, and gender. The task force needs all of us to engage with them so that they can have a politically strong proposal that can be passed by the legislature. They're required to consider the benefits that are provided by Medicare, Medicaid, and the public employee healthcare systems that we already have in place in the state. So I think we can be assured that the coverage that will be provided will be strong and very broad. To become informed takes a little bit of effort, but you can learn more about Senate Bill 770 and the task force at the website for Mid-Valley Healthcare Advocates, MVHCA.org, and at the legislative website that is shown on the screen. The website for the task force also has an email link where people can comment on any subject before the task force, by email. You can also register in advance of a meeting to provide oral testimony. So the ability of the public to engage in the process is easy to access and important for all of us to participate in.
So before we close, I just want to bring a story to you to let you know how important it is that we act. A nurse at the cancer center told me this story. A middle-aged couple were in one of the exam rooms. She overheard the conversation. Honey, they say I have stage 3 lung cancer and that I need chemotherapy and radiation therapy. There's no guarantee that the treatments will work. I'm going to refuse treatments because I don't want to leave you and the kids homeless. In no other country where it is safe to drink the water would you hear that conversation. This is not freedom. This is not sustainable. In the practice that I had at the cancer center, some patients had waited months or even years until pain, bleeding, or other problems forced them to the emergency room and then to the cancer center. It was gut-wrenching to see this happen, and it happened repeatedly. Before I retired 14 years ago, I decided to devote my post-retirement years to preventing these tragedies through a publicly funded universal healthcare system. You will have freedom to grow your business, pay for groceries, housing, education, and vacations. You will not have to worry that the next surgery or illness will empty your bank account. You will have sustainability if your healthcare costs are reasonable and predictable. Sustainability of personal and business budgets if you're not facing the unpredictable and often double-digit increases in health insurance premiums, deductibles, and surprise bills. So what can you do? You can make a difference. You can offer your time to many organizations who are fighting for universal healthcare. Here in the Mid-Valley, it's Mid-Valley Healthcare Advocates. You can join by coming to the meetings that Karen just mentioned. You can donate money, checks at this address, or go to the Mid-Valley Healthcare website and use the donate button there. And please contact your legislators. Let them know what you know you need for your family. Again, thank you for attending. We are fighting for healthcare for all. We think that will bring freedom and sustainability to our individual lives and our communities, our state, and eventually the nation. Thank you.